Before we get into today's vlog, I want to say a huge thank you to Skillshare for sponsoring today's video. Skillshare is an online learning community for creatives where millions of people come together to take the next step in their creative journey. It's suitable for beginners, pros, dabblers and masters. Members get unlimited access to thousands of inspiring classes with hands-on projects and feedback from a community of millions. Even for those of us who are particularly busy, it's perfect. Most classes are under 60 minutes with short lessons to fit your schedule. This is your chance to learn something new that you've always wanted to try. I'm particularly excited about Gary Vaynerchuk's classes. I love the fact that Skillshare gives you access to teachers like Gary V. The first 1,000 of my subscribers to click the link in the description will get a free trial of premium membership so you can explore your creativity. Outside of my busy work at the hospital, I love taking Skillshare classes. It's a great way to be creative, to learn something new and to join a community of like-minded people. So guys, I hope you enjoy the trial of premium membership. Remember that the first 1,000 of my subscribers to click the link below will get a free trial so you can explore your creativity. Enjoy! Well, hello everybody and welcome back to another vlog. Today is Saturday and I am on shift 2 out of 3. Yesterday's shift was really interesting. I started in majors and then I got pulled into resus because they were really busy with lots of traumas. There were lots of car accidents, people falling downstairs, all sorts of things that were happening yesterday. And yeah, it was a very interesting and busy and frantic shift. Today, I have no idea what we're going to see. I don't know which area of the department I'm going to be working in, but we will find out together. And at the end of this vlog, we'll sit down and I'll chat with you about all of the cases I've seen, or some of the cases I've seen. If you're interested in seeing more interesting patient cases, then I have loads of vlogs over on my vlogs playlist on this channel if you haven't been here before. So go and check those out. And yeah, let's go and find out what today holds. This morning, I had a nice morning. It's midday, I'm doing a midday till 10 p.m. shift, so I had a nice lazy morning. Vince and I had pancakes for breakfast and I made myself a really nice frothy coffee, and yeah, we've just taken Bonnie, our little dog, out for a walk, so a nice slow start to the day, really feeling refreshed and ready for this shift. So yeah, let's go and find out what we're going to see. Today I'm working in the urgent treatment unit, which is basically for the walking wounded. It's patients that are well enough that they can be up and walking around, not needing to be on a trolley in majors, but they are generally too sick to wait for a GP appointment. They've normally called 111 and been advised to come into the emergency department. So I start my shift by giving my cubicle a good clean down, and yeah, then I crack on with seeing patients. We see a really wide variety of things in the urgent treatment unit, everything from chest pains, broken bones, animal bites, you name it, we see it. And today is no different. At about 6 o'clock, I go and have my food, and today I've brought with me some pesto pasta that I made in advance, and I froze the little portions of pesto, and then it's time to get back to work. 10 o'clock now, it's home time, and for once I'm actually finishing on time. That was a surprisingly calm shift. You never know what you're going to get in the emergency department. Yesterday was absolutely manic and today was reasonably civilised. Right, I'm back to my car and it's cold and gloomy and very dark and terrible lighting, so I think I'm going to just go home, go to bed, and then tell you all about my cases and patients tomorrow, and it will probably mean that I can get my words out better. The last patient that I saw, I was really struggling to think of the right things to say, the correct terminology for things. So yeah, I can tell I'm getting tired and I need to go to bed, so catch up with you in the morning. That's much better. It's nice to be at home. Since we've moved house, I've actually lost my tripod. I can't find it anywhere, so I'm gonna have to film this holding my camera, but we'll make do, it's fine. So yeah, it was really nice driving home yesterday. As I've mentioned in previous vlogs, I actually love my commute to and from work. I use it as a time to just kind of decompress from the shift or prep myself for the shift. I listen to audiobooks, which I love. It's such a great way of consuming books and taking your mind elsewhere or learning new things. And I love to listen to podcasts as well. And recently I've been listening to a book called War Doctor, and it's a book that has been on my reading list for a really long time. I heard an excerpt of it on Radio 4 after driving home from a night shift once, and I knew that it was a book that I would really, really enjoy. Just about coming to the end of that, and it is so phenomenal. Honestly, really, really good book if you're interested in anything medical, which I assume you are if you're watching this video. You will love this book. It's just like, it's one of those books where you're so absorbed in it, you kind of lose where you are in real life. So yeah, I'll link it down below if you want to check that out, and really good listening on audiobook because you can obviously do other things while you're listening. So yeah, I've got a link that will give you a free audiobook if you aren't already subscribed to Audible. It's not like an ad or anything, it's just a free link. So yeah, go and check that out. But anyway, talking about my shift yesterday. So yeah, I was in the urgent treatment unit, and that is a place where people will come into A&E and they are able to walk. They don't need to be on a trolley. It's meant to be more severe than a walk-in centre, but not so severe that they're rushed in and have to be lying on a trolley. So you see all manner of things, from people with minor injuries all the way through to people having heart attacks and strokes. So you kind of have to keep your guard about you and remember that although patients can look quite well, they can deteriorate quite quickly, or it can be deceptive, and you need to make sure that that we still do the tests and things that we need to do. A couple of interesting cases that I saw yesterday. I actually had a medical student with me for a bit of the shift, so it was quite good because we got to do a bit of teaching and yeah, talking about some cases. So if you're watching, hi Wen, it was lovely to meet you. Thank you for being such a lovely student. So yes, one of my patients was someone who came in with, the notes from the nurses said lightheadedness and fainting. The thing with lightheadedness is it's really important, or dizziness it said actually. Oh, Alexa's telling me that someone is at my front door. There was no one at the front door. Okay, back to it. So the thing that's interesting about dizziness is that it can mean a few different things, and we really need to clarify what people actually mean by dizziness. So is it that they are lightheaded, and we call that pre-syncopal, which is basically pre-syncope, pre-fainting, and that's that feeling where your vision starts to go, you feel as though you're about to pass out, you don't feel quite with it. There's another type of dizziness which is vertigo, and that is where people talk about the room feeling as though it's spinning, and they often hold on to things to steady themselves, and they feel as though they're unbalanced and they're going to fall over. When we're taking a history, it's really important to dig down and actually work out what they mean by dizzy, because that they can lead to very different diagnoses. There's so many different things that can cause you to feel pre-syncopal and different things that can cause you to have vertigo, and some of them are quite benign, but others are very serious. And this person had vertigo symptoms, and they described it really well. They said that they felt as though they were drunk walking on a boat, and that they had to lay down to steady themselves. This person was middle-aged, and one of the things that can cause vertigo is problems with the middle ear. But another problem that can cause vertigo is something going on in the brain, specifically in the cerebellum. And if someone's middle-aged, we start to worry, or when someone gets to middle-aged or elderly, we start to worry that potentially it could be something happening in the brain. So we always get a CT scan if someone presents with those symptoms. And this patient had actually had a cerebellar stroke, so a stroke at the back of the brain. And I think they were quite surprised when I told them that, and that they were going to have to be admitted, because they had only come in because their partner had suggested that they come in, and they thought they were just coming in to get some, medication to take away the symptoms. And yeah, quite a surprise diagnosis for them. But it's really important that they do get admitted, because if you have a stroke, you can have further strokes quite soon after if you're not on the appropriate treatment. And yeah, it's important to make sure people are taking all the right medications. Another interesting case that I saw with the medical student was the nursing note before I saw the patient. The only information I had about this patient was that it was someone who had back pain and urinary symptoms. So before I saw this patient, or before we saw this patient, I said to the student who was following me, can you think of any differential diagnoses? What's going through your mind when you see these two things together? And we brainstormed some ideas. So if any of you are interested in kind of playing along with this and want to have a think about some differentials for this, back pain and urinary symptoms, it's quite vague. So cauda equina syndrome is one of the things that we thought of, and that can present with back pain. That's compression of the bottom of the spinal cord, the cauda equina, and that can present with back pain and urinary symptoms. So typically urinary retention, people not being able to go for a wee because the nerves that supply the muscles that allow you to go for a wee get compressed and they don't work. Another thing we thought of was pyelonephritis, so a urine infection that has spread up to the kidneys, so giving you urinary symptoms and back pain because of the pain in the kidneys. The other thing we thought about was stones, kidney stones, again, back pain, and then giving you urinary symptoms. Quite often people with kidney stones have hematuria, which is blood in the urine from the trauma of the stone actually passing through the urinary tract. So those were just a few of the things that we came up with, and it was just interesting to kind of brainstorm those and think about things before you see the patient, because a lot of the work that we do as doctors and medical professionals is prep work and thinking about things before and after you see the patient. And it's in A&E, the most important thing is to go in with an open mind and work down from the most serious to the least serious, but making sure that you are safely ruling out those really important diagnoses that you don't want to miss. So had an interesting day. I always love having students with me. It's really good fun to, think about things from their point of view. And whenever I have students with me, I find that they ask really good questions and it kind of tests my knowledge. And it's nice to have that, you can't get complacent. So really, really good fun. And guys, some wonderful news from me is that I am feeling as though I am recovered from long COVID, or at least I'm like 98% of the way there. It's been a very long journey. I had COVID at the end of September, start of October, and it took me really a good 5 months to actually feel better. I can't remember how much time I had off working, and it was like 6 or 8 weeks. I was really, really fatigued, sort of getting 12 hours of sleep a night and still feeling like I needed a nap in the day. Only being able to kind of do one task in the day and then feeling completely zonked for the rest of it, and I was really struggling with my breathing. I think I mentioned in another vlog that I ended up leaving a shift because I was struggling so much with my breathing, and then had to have quite a lot of time off work, and I had to stop doing night shifts, which is a shame because I really love working nights. But I'm really starting to feel normal again. When we moved house, I was saying to Vince that it was a really long day. We were like shifting boxes all day and doing all the things you do when you move house, and then the next day I woke up and expected to feel completely out of it, and I was okay. Like I was a bit achy and I was a bit tired, but the normal amount, and it was like, oh, I feel so good, I've got my body back. I'm still having to take things a little bit slower than I would do previously, like before I had COVID, and I'm still using more inhalers than I had to use before. I've got asthma, but it's very mild and well controlled. But it's really, before I was having to use, a couple of months ago, I was having to use my salbutamol, my reliever inhaler, at least a couple of times a day, and kind of having an asthma exacerbation most evenings. So it's just nice to start feeling better. I feel like there's light at the end of the tunnel now. I just wanted to update you guys because I've had a few of you lovely people asking me how I'm doing with that, so thank you for your care and concern. And to those of you out there who are struggling, I really hope that you're okay, and just remember that you're not always going to feel like this. Things will get better. Anyway guys, this has been another very long vlog. It's been so nice to be able to have a bit of a chatty catch up at the end, and go and head down onto the description box and read War Doctor. It's really, really, really good book. Catch up with you next time. Bye.